everyone, my name is Mari Carcino, and today I'm gonna show you the CPR compression of the adult. Now, CPR compression of the adult and also on the child has almost had the same, but there is something changes there by using how you're gonna use your hand. Okay. Now, first thing you have to do is to secure scene safety. Done your gloves, and if you had a mask, you have to wear your mask because we don't know what's on her or on him. Now, check for responsiveness by tapping both shoulders and call out a name on both ears, like this. Hey, are you okay? Hey, are you alright? And then when she is not responding, if he's not response, call for help. So there's a lot of people around you, so you can use them for help. So now I'm gonna look for someone like really close to my eyes, like this. Hey, you wearing white t-shirt, blue jeans, can I help her? And then when Jay say yes, okay, can you please call 911 for me? What is your name again? And then when she says, Linda, can you please call 911 for me? Alright. While she's calling the 911, then you have to proceed by helping her. So, first thing you have to do is to open airways and check for breathing and circulation for up to 10 seconds. Not breathing, if there's no sign of circulation, proceed to the cardiopulmonary respiration. And you have to, like what I said earlier, there is a differences of the child. Because the child, you gotta use one palm. The adult, you could use both hands. Well, you have to use the dominant, the non-dominant, put the non-dominant on the chest and followed by your dominant hand. So it's like this. Okay, when he's on the ground, you have to bend on your knee, of course, and you have to position yourself that you could grasp the strong enough that you could help the patient. So this is my non-dominant and this is my dominant. I'm gonna put this on top. And I'm gonna proceed the CPR by counting 30 counts, and by counting 30 counts and to breathe. 1001, 1002, 1003, 1004, 1005, 1006, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 7, 8, 9, 30. Now, have you noticed that my hand or where you get your strong CPR is on your shoulder. You cannot twerk or you cannot use your butt or shake in your butt while you're doing your CPR. Now, there's another thing that you could do if you are comfortable of giving a breathing for the patient, you could do it. But if you wanna secure it, and then you have this artificial respiration breathing mask, you could do this, or you could use this to her or to him. So this here there is pop up. You could put this in her mouth and you could start blowing it. That air won't come back to you on your mouth if you're gonna do that. So, but if you're not comfortable, then do only the compressing. So, when you're gonna, assuming that I want her to give some breathing, I'm gonna put this in his mouth, and then I'm gonna pinch the nose, and then my other hand is gonna be on his chin, and then lift up his chin a little, and then start blowing. But once you start blowing it, you have to assure that when you're blowing, your eyes is right on his chest. Okay, like this. But your eyes is on his chest. And then do again CPR compression. And again, the dominant hand is on the top. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 3, 24, 5, 26, 7, 8, 9, 30. And then do again the air. Give him air again. Do that until 5 times while you're waiting on the 911. But if you are not comfortable to give him some air because you're trying to avoid to get some disease from her, we don't know, because she is completely strangers. Like what it says, secure yourself first. And then just give compression. This is gonna be good. You have to give the CPR until that help will come. Complete recoil after each compression. Avoid excessive ventilation. Provide ventilation every after one cycle of 30 seconds. Continue a cycle for 30 compression. Continue CPR for 30 seconds, 30 compression, and also 2 breathing by mouth. After 5 cycle or 2 minutes of the CPR, release patient by checking pulse and also breathing, and also more breathing is not more than 10. Release or reassess patient after 2 minutes. If return of the spontaneous circulation is not achieved, repeat the procedure. Once ROSE achieved, place patient in a recovery position. Now, assuming that my patient is breathing is good, while and then the patient, the 911 or the call help is not in here, but my patient is already breathing good, you have to put her in a place where she is comfortable, or he or she is comfortable. And then it's time for you to write the document. Which is important is the time the procedure started and the time the procedure that you end. Because when that help will come, they're gonna ask you all that question. When you start helping him, how you see him, what time that you ended helping him, and on. So it is really important to document all the details. And that is for my adult CPR compression. Thank you for watching.